afternoon, Mr. Chair and members of the Senate. I represent a number of stakeholders in my community. I can talk to you about the community mental health side of things. I can talk to you from strictly the law enforcement side of things, but I'm certainly from a group of constituents of yours that you will probably never see in this room. Those are children. What I do beyond being the sheriff is I advocate for children. And one of the things that I understand more so than anything else is prevention is cheaper than correction. In more ways than one. And as sheriff of Newport News, which is probably in the top 5 cities in population-wise in this Commonwealth, I see more and more every day the effects of mental health, with 30% in my jail suffering from mental issues. I see the effects that happen throughout the community from violence and the use of violence. So as sheriff, I have a vested interest in protecting public safety. As a citizen of Virginia, I also want lawmakers to make smart use of tax dollars. For these reasons and more, I am among many in law enforcement who hope our state takes advantage of the critical opportunity to provide affordable health care to more than 400,000 people that are currently uninsured. As you carefully consider the opportunity which would use federal funds to cover people who don't earn enough to afford private insurance, but earn too much to qualify for federally funded insurance, implementing the plan would reduce crime in several ways. And again, look at how do we get ahead of things rather than react. In law enforcement, we often react. You call us, we come running, we deal with it. We have to find a way to be smart. First, it will enable women who are battling substance abuse problems to get health care coverage before they become pregnant, thereby reducing parental exposure of their children to drugs and alcohol. This was crucial because the University of Michigan study that followed individuals born with prenatal alcohol exposure found that 60% of the adults had some trouble with the law, and 35% of the adolescents and adults had been incarcerated. Unfortunately, with the present system, women who cannot afford private insurance can only get federally funded insurance once they know they're pregnant. Yet, the more serious damage to a developing child is done by alcohol exposure in the first 7 weeks of pregnancy. When many women are unaware, they have conceived. Expanded health care coverage will enable more women to get treated for substance abuse before they become pregnant, which will reduce the number of children born with these problems and ultimately reduce crime too. Enabling parents to gain coverage for treatment of substance abuse will also protect children because up to 2/3 of children that are abused and neglected involve parents who abuse drugs and alcohol. Approximately 98,000 parents would gain coverage in Virginia, enabling them to gain access to drug and alcohol screening and treatment. This could help reduce the 5,800 confirmed victims of child abuse and neglect in Virginia each year. Research also shows that children with uninsured parents are 3 times more likely to be uninsured than children whose parents have coverage. Approximately 25% of the 98,000 Virginia parents who would become eligible have children who are already eligible for Medicaid but are not yet enrolled. That means that as many as 25,000 in Virginia are more likely to be covered by insurance. The outcome is also key to lowering crime. Children and teens with aggression, and we see this every day, or substance abuse problem, who have health insurance coverage will be eligible for treatment that steers them away from violence and drugs. As profiled in the report by Fight Crime Investing Kids, these interventions typically cut future arrests in half or more, and they save an average of $25,000 to $30,000 for each child. Ladies and gentlemen, if you are one of the lucky individuals who has affordable health care, quality health insurance, you might be tempted to ignore these facts, or to assume that those who would benefit will find another way to gain coverage if this opportunity fails. Yet 70% of Virginians that are uninsured come from working families with few other options, which brings me to the ultimate benefit for taxpayers. The U.S. Center for Disease Control and Prevention found the nation spends an estimated $3.6 billion to deal with fetal alcohol syndrome, but suggests that the cost could be much higher. The cost of not providing medical treatment to vulnerable parents and kids is also expensive. A troubled youth who drops out of school, uses drugs, and becomes a criminal will cost society an average of $2.5 million. Simply put, out of sight, out of mind does not work when you're staring down the barrel of a gun, and it doesn't cover the state incurred costs of years of special education or imprisonment for our children whose lives are jeopardized by birth defect and abuse. For these reasons and many others, I ask you to support the expansion. Thank you.
Thanks, sir. Okay, next question. Washington Sheriff of